A production fee has been paid to WBBZ-TV by Buffalo Healthy Living and its sponsors. According to the Yale School of Medicine, approximately 1 in 31 U.S. children and 1 in 45 U.S. adults are diagnosed with autism. This has increased roughly 300% over the past 2 decades, driven by greater awareness and broader diagnostic criteria. Boys are 4 times more likely to be diagnosed than girls. And adults, well, statistics are rising with a 450% increase in adults aged 16 to 34 who are diagnosed with autism. Now in the U.S., studies show us lower prevalence among white children compared to other groups with higher rates in Hispanic, Black, and Asian Pacific Islander children. Now we're going to talk one-on-one with a 2022 Nobel Peace Prize nominated researcher about autism on this special edition of your Hometown Health Connection, brought to you by Buffalo Healthy Living magazine. I'm John DeSciullo, honored to welcome back to our program Dr. Peter J. Hotez, an American pediatrician, scientist, and advocate for global health, vaccinology, and tropical disease control. He holds several positions at Baylor College of Medicine, including Dean of the National School of Tropical Medicine and Professor of Pediatrics in Molecular Virology and Microbiology. He also holds an endowed chair in tropical pediatrics at Texas Children's Hospital, where he co-directs the Center for Vaccine Development. For Autism Awareness Month, a few voices resonate as powerfully as Dr. Peter Hotez's, a physician, scientist, vaccine expert, and father of a daughter with autism. In his deeply personal book, Vaccines Did Not Cause Rachel's Autism, Hotez blends science with lived experience to address one of the most persistent and harmful myths in public health. Dr. Hotez's daughter, Rachel, was diagnosed with autism when she was a toddler. Like many parents, he and his wife experienced confusion, grief, and the challenge of managing therapies, education, and long-term care. But unlike most parents, Dr. Hotez also brought decades of scientific experience to the question that still troubles many families: what causes autism? His answer is clear and unequivocal: vaccines did not cause Rachel's autism. So welcome back, Dr. Hotez. Why do so many people still believe today that vaccines cause autism? Wasn't that theory disproven years ago? And why are people still confused?
Yeah, John, well, thanks for having me. Yeah, it's been disproven, dozens of times. And I have to use the word dozens because what happens is these anti-vaccine groups that are monetizing the internet and unfortunately in some cases selling phony baloney supplements and to the community of autism parents that do nothing for autism in order to monetize the internet and sell this stuff and have their $1,600 telehealth visits. They have to lie and make up stories that vaccines cause autism. So we got into this situation. It all began with the start of the internet, really, around 2000, and it's gone through multiple iterations. So what you see is they keep on switching it up what their actual allegation is. So it started out with false claims that it was a measles, mumps, rubella vaccine causing autism. That was 1998. It was published in a paper in The Lancet that turned out to be fraudulent and was retracted. Then Kennedy came on the scene. Robert F. Kennedy Jr. came on the scene and said in 2005, no, we didn't mean the MMR vaccine. We meant the thimerosal preservative that used to be in vaccines. And he wrote that in an article in Rolling Stone magazine, also published in Salon magazine. And of course, that was fraudulent as well and retracted. And then it came up that then you had, if you remember, Jenny McCarthy and her husband Jim Carrey started parading around in green T-shirts saying we have to green our vaccine ecosystem and said autism is being caused by overwhelming the immune system somehow. It was all fake, and that was debunked. And then it was alum vaccine. So it's just become this unending cycle. And of course, now that Kennedy is head of Health and Human Services, he's resurrecting all that nonsense again. And so, and they control the information machine, and then that's the reason why it won't go away.
Very troubling for experts like you. You describe autism as a complex neurodevelopmental disorder rooted in genetics and early brain development, and definitely not caused by routine immunizations. But what do we know about these genetic and environmental factors, and how many genes have you or others been identified with autism?
Yeah, so about almost a decade ago, I got at the request of the National Institutes of Health. They asked me to talk to Robert F. Kennedy Jr., and I had a year of discussions with him on cell phone and Zoom and things, and mediated by a third individual, a Kennedy of sorts, Tim Shriver, who was great, but Kennedy was deeply dug in. And here's what I'd say to him: I said, "Look, we have more than 100 genes involved in autism." Including the one we identified with Rachel through genomic sequencing. So there's 100 genes involved in autism. At least they're all involved in early fetal brain development, and they all interact, during early pregnancy to alter the function of neurons in the brain and how they connect. So many of them are structural proteins of neurons. They encode structural proteins of neurons, which makes a lot of sense, right? And I mean, that actually makes sense as opposed to something called autism, than for something that used to be called pervasive developmental disorder. So the point is, we've learned a lot about the genetic basis of autism, the autism genes. Unfortunately, not enough parents are doing genomic sequencing to identify the gene, because sometimes it can point to other disorders, because it's not just genes around autism. Sometimes they're involved in the function of the heart or the intestines, and that's why I think we should be doing genomic testing on all kids with autism. And it also doesn't mean that there's no environmental effects, but they're environmental exposures, John, that are happening early in pregnancy. And we have a couple of good examples. And by the way, Tylenol's not on the list. That if you remember last year, they came out and said Tylenol. It's not Tylenol. But for instance, here's what we know: if you are pregnant and not aware of it, and you're on an anti-seizure medication called Depakote, also known as valproic acid, it's used as anti-seizure medication, also a mood stabilizer. It's contraindicated in pregnancy. Obstetricians will not allow its use in pregnancy. Why? Because it interacts with autism genes and gives you an autism phenotype. And there are about 4 or 5 known chemical exposures in early pregnancy that we know will do this. And this was why I was so frustrated talking to Kennedy, because I'd say, Bobby, man, you're an environmental attorney. This is your sweet spot. You should be all over this. And it was he's the one who had no interest in it. And so this remains uninvestigated. So, if you look at why we've seen a rise in autism diagnoses, I think a lot of that is because of shifting criteria, and we'll talk about that in a minute. But there's probably also some true increase from environmental exposures early in pregnancy that remain uninvestigated.
We have a lot to cover, Doc, in our short time. Speaking of genes, 2 scientists here in Buffalo have a daughter with a mutation in her FOXG1 gene. Annette Pinder did some research and found this out, which is associated with many autism traits. She was diagnosed at 2, is now 13. Both parents at UB are scientists, have spent the last 11 years developing a gene therapy designed to deliver a healthy copy of the FOXG1 gene to the brain. Preclinical studies in the mouse models have shown the ability to rescue brain structural issues, and clinical trials were cleared to begin this year. We also recently encountered a case of a 5-year-old in Buffalo who had lost all language ability by age 3, who received stem cells in a clinical trial at Duke. Now 13, he's an honor student. What other research are you aware of that is underway here in Buffalo, or where you are at Baylor, that may provide more insight into autism, primarily with these genes?
Well, I think, you brought up a bigger point, which is that, with the science has advanced so much, we can learn so much about the genetic basis of autism and how to improve performance and behaviors in kids on the autism spectrum. But it's all getting drowned out because of phony baloney nonsense about, blaming vaccines or to things to benefit the very corrupt wellness and influencer industry that's trying to peddle all sorts of fake cures and vitamin supplements and this kind of stuff that the kids don't need. And so it's really important that we bring it back to the science. And that's why I was grateful to have this opportunity to talk to you. But let's actually talk about the 2 paths here. I mean, it's not vaccines, but one, there's environmental exposures that interact with autism genes that haven't been looked at. But let's look at some of the reasons why the numbers appear to have increased. Beyond the environmental exposures, which may be a genuine increase, there's other stuff going on. So, Kennedy goes around talking about an epidemic. But here was what was going on. Back in the 1990s, when Rachel was diagnosed, there were 4 different categories linked to autism. There was something called, and this was based on what's called the DSM, the Diagnostic Statistical Manual. That's the big book the psychiatrists use to diagnose different categories of different conditions. Back then in the 1990s, when Rachel was being diagnosed, there were 4 different categories. One was something called autism, which was primarily restricted to the nonverbal boys. And then there was something called Asperger syndrome, which was kind of, what some people would call high functioning autism. And then there were 2 intermediate categories of pervasive developmental disorder and then pervasive developmental disorder not otherwise specified, NOS. What happened was with the next iteration of the DSM, they collapsed that all into one category that they called autism spectrum disorder. So what was 4 categories was now 1 category. And so, of course, the numbers are going to go up, right? And then the other thing that happened, though, John, was we got much better over the years at diagnosing autism in girls and women. We used to say it was 10 to 1 boys to girls, then it was 4 to 1 boys to girls, and 3 to 1 boys to girls. It's probably closer to parity because we've gotten better at understanding the cues around autism in girls and women. So, for instance, even today, a lot of the girls and women on the autism spectrum, their diagnosis gets missed because there are sort of comorbidities that get diagnosed, such as their obsessive compulsive disorder, or a lot of the teenage girls with their eating disorders are actually on the autism spectrum. And so the numbers, by the way, are going to go up again as we get better in diagnosing, continue to get better at diagnosing it in girls and women. We also are doing a better job in schools, especially schools in low-income neighborhoods, of diagnosing kids. So all of that is contributing to the apparent rise in the number of cases, which is not a true rise, but more awareness, more sophistication in our diagnostic categories, but also a genuine true rise in things like environmental exposures early in pregnancy.
So how does this spreading the false idea that vaccines cause autism put young people at risk and threaten the public's health, the future of public health? It seems as if, like you said, more diagnoses are being made, but not because of what people think of the vaccinations. Why? I can't believe you're the only voice that's critical of what these so-called others that are not scientists are saying. How do you join the rest? How do they join you in being critical of this vaccination theory?
Well, thanks for asking. I mean, there are some good organizations out there that are really trying to get the word out about and educate people about autism. And for instance, the Autism Science Foundation, based in New York State, I think is really headed by Allison Singer, really trying to get out good information about autism. But as long as people will feel like they can monetize the internet, they're going to push it. And unfortunately, the White House didn't help us last fall. They held this very unfortunate press conference. Well, first of all, what happened was, Kennedy comes out in April around this time last year in 2025, and he announces, one of his first actions as Health and Human Services Secretary, he's going to find the cause of autism and the cure for autism, which was ridiculous, right? Because, we know there's at least 100, probably several hundred different autism genes, all involved in early fetal brain development, interacting with, in some cases, environmental exposures early on in pregnancy. I mean, think of something like cancer, for instance, which we know are hundreds of different oncogenes and different environmental exposures. Nobody with any knowledge would say, now we're going to announce that we're going to find the cause of cancer and the cure for cancer, right? Because everybody knows there's dozens of different types of cancers and different environmental exposures. And this is what he does. And, he comes up with these sort of simple things that are based on his refusal to try to understand the science. And so it's really important to bring it back. And then, of course, he doesn't deliver on the promise. And then he comes out in the fall of last year at this unfortunate White House press conference, and all of a sudden now it's Tylenol.
Yeah, where did that come
And,
from?
I mean, there was one type of paper called a meta-analysis that looked at hundreds of different studies, and all meta-analysis come out with the same kind of stuff. Some showed a modest association, others showed no association, and others showed actually that Tylenol was protective against autism. But somehow they wanted to cherry pick that and say that was the cause, when in fact a year before a major paper came out clearly refuting any link between Tylenol and autism. And that's really unfortunate because, we don't have a lot of medication to give to pregnant women if they have fever or pain. And fever itself is a teratogen. Fever itself can cause birth defects. So to let women now have fevers unnecessarily because they're spooked about autism was really irresponsible. And the same with leucovorin, which was then touted as a magical cure. Leucovorin, maybe will help a small subset of kids on the autism spectrum, but it's just that. So again, it's this kind of childlike thinking and naivete and unwillingness to really address the science of autism. And of course, then, and it's not just the science of autism, John. What do parents of kids on the autism spectrum don't have the support that they need. And by the way, Rachel is now an adult, and she's an adult with autism and intellectual disability. She can't live independently. Where's the help there? I mean, the bottom really falls out with the adults with intellectual development.
Well, Doc, in the 10 minutes we have left, that was one of the questions we wanted to get to. Do those with autism, yes, you're right, there's a lot of programs for children, but then they sort of age out. And what do parents do? What are you doing?
Yeah, I mean, this is the thing we're struggling with. So Rachel now has, Rachel has like a verbal IQ in the 80-90 range. She's very verbal. She has a functional IQ in the 40s, so she can't count money. She can't live independently, but she walks to Goodwill Industries in our neighborhood, and she loves it, and she has friends there. But what's the plan after we're gone? We have no plan. I mean, it's because there isn't that kind of safety net. And those are the things that parents worry about. And instead, Kennedy comes out with this really obnoxious, it's really harmful language, and he talks about people on the autism spectrum. He says they can't use the toilet and they don't contribute to society. They can't, they'll never earn money or pay taxes. Well, Rachel earns a paycheck, and she's probably one of the few Americans that is excited to pay taxes. And so the way he talks about them in this very dark eugenics kind of way. And then he wants to create his lists of people on the autism spectrum. And I'm like, hell no, I'm not going to put my daughter Rachel on one of Kennedy's twisted lists. And so I think, we have to really look out. And I think the other subtlety in all of this, John, is especially when we talk about curing autism, you have a wide range of what we call neurodiversity, people, that may have a diagnosis of autism, but they're very comfortable with it, and they're productive, and they have normal or even high intelligence. And if you talk to people like that, they say, wait a minute, they don't want to be cured. They're very comfortable with their lives and what they're achieving in life. And so it requires a lot of sensitivity and thought. And I think, if you're going to start having these kinds of discussions, especially around gene therapy, it's really important. And I know UB has a great team of bioethicists, really bringing the bioethicists to get help on this point.
We have a few minutes left, Doc. I would imagine having a child diagnosed with autism is overwhelming for families. I'm sure it was for you. And then when you add to that, what you just said about some of the negatives, I would think parents go apoplectic about what to do and how to do it. And I guess, too, going back to the Tylenol, it's maybe human nature. You're looking for that silver bullet. You're looking for that one cause, and the answer's there. But go back to the first part about how parents are somewhat apoplectic about their child when they're
Well, I
diagnosed.
think I don't know about apoplectic, but they often feel abandoned,
Yeah.
and because there isn't that support, and having this Department of Health and Human Services talk about it in such childish terms and baby talk is not helpful. And again, no one is offering to roll up their sleeves and actually help families either financially or help provide some levels of support, especially when they become adults with intellectual and developmental disabilities. So what I did, John, is I wrote that book, Vaccines Did Not Cause Rachel's Autism, almost a decade ago after talking to Kennedy. I've now done an update, and you can get it on we have a Public Policy Institute linked here in the Texas Medical Center. Across the street from the Texas Medical Center is Rice University, and they've got the James A. Baker Institute of Public Policy. And I have an appointment there, and I put up an article about creating an autism roadmap for the things we really need to do for parents. But it's not something that comes out in a 30-second soundbite, right? It's not a 30-second UNICEF commercial. It takes time to really explain the complexity of autism, and that's why it's a spectrum disorder. It takes time to unravel all the different genes and all the different opportunities, and that's part of the problem. Kennedy just comes out with these really weird sound bites, and it's not helpful for the community.
Well, people should take a look at your book for sure. How would you advise a parent or a grandparent who may be watching this who had a recent diagnosis? Could you share some personal insight?
Well, when Rachel was diagnosed, I was on the faculty of Yale University School of Medicine, and we were blessed because Yale has the world-famous Child Study Center that with some of the world's leading experts on autism, people like Fred Volkmar and Linda Mays and others, and Ami Klin at the time. And so I would say, Buffalo is probably in a similar situation. I don't have details specifically about autism, but University of Buffalo is one of the top medical centers in the world, and therefore I'm presumably either Buffalo Children's or the university itself would have real experts in this to help advise, and it usually requires sort of an interdisciplinary approach that brings in not only child psychiatrists but behavioral pediatricians, developmental pediatrics experts, and so getting the right diagnosis and working out a plan, I think, is probably paramount. Unfortunately, we don't have enough of them. Child psychiatrists are rare as hen's teeth these days. We just don't have enough. And so the waiting list for some of these kids is ridiculously long. And so that's something that we have to really work on also, is bolstering our workforce around not only autism, but all of mental health.
So we just have a few minutes left. What can we do, or what could you suggest to change some of this misinformation? And can medical schools help? Is it getting new people who are interested in the science? My daughter does cognitive testing at a location here in Buffalo. Finding the people to change this culture.
Yeah, well, I think condemnation of the kinds of things that RFK Jr. in this Department of Health and Human Services has been doing around autism, I think that's important, and debunking the disinformation. A lot of it now is being used just for greed, for the very corrupt wellness and influencer industry to make up stories about people with autism so they could sell their garbage and pair it with expensive telehealth visits. So calling that out, I think, is really important. But that's not sufficient, because I think, it's not enough to get out there and say, don't blame the vaccines, because then the logical question is, okay, doc, now I get it. Vaccines don't cause autism. Hey, doc, what causes autism? And we need to, be able to articulate in a concise but accurate way the role of autism genes and early fetal exposures, and explain, how that then translates into expanding brain volume that starts at birth and then accelerates between the first and second year of life. So parents really start to understand it. just as we've done for other conditions, and do it, of course, with the sensitivity around this whole community of neurodiverse people who, there's no point in and just offending them and making them feel like they're lesser when they're not. They contribute as much to society as anyone.
For sure they do. And I would just want to remind people we're talking to Dr. Peter Hotez, and if you would like more information on his work, you can go to this website, Peter Hotez, spelled HOTEZ.org. And the name of the book is Vaccines Did Not Cause Rachel's Autism. We had a half hour here, Doc, and hopefully we'll spend more time together. But I just wanted to personally thank you for your remarkable work, your selflessness, and your humanitarian efforts. And here at Buffalo Healthy Living Magazine and WBBZ-TV, we're honored to have somebody of your stature to share this information. Any final thoughts in our last minute?
No, other than, I think these kinds of longer formats are really important because it's really hard to do this in a 2-minute soundbite, right? I mean, it's a complicated situation, and the way I say it is not a 30-second UNICEF commercial. You need time to let the story unfold, and that's why, when you asked me to come on, I was grateful because it is one of those rare opportunities to have this kind of meaningful discussion. So thank you.
You're welcome, and thank you, Dr. Peter Hotez in Baylor, down in Texas. We'll see you again soon, and good luck to you, and thank you for watching. A production fee has been paid to WBBZ-TV by Buffalo Healthy Living and its sponsors.